for a long time been doing a health check every probably for 10 years. So I did this annual health check, a bit like an MOT, which sets out your blood count and all the other variations in your living style. But probably the most important one was the PSA, which I could see was going up generally year on, year out. And about 2 years ago, it had reached a level of, I think, 7 at that point. And I was then advised to go and see Mr. Dudderidge as the consultant. So initially I was sent for a scan. I think it's called a 3D scan, where they're able to map your prostate. The biopsy was able to be targeted at the anomaly they had found. And it was at that point when I went back to see Mr. Dudderidge that they'd found almost just 1 millimetre of cancer. So it was very fine, very small. And that was the point I was told I had cancer. I was then given a lot of literature to think about it, and I went away and considered the different options and different treatments and how I felt about it. So went back to see Mr. Dudderidge, at which time his recommendation was active surveillance. And we talked for quite a while about active surveillance and whether this was what I really wanted to do. I just didn't like the fact of having to sit around knowing I'd got cancer, sit around not absolutely understanding if it was growing or not growing, and there's always a chance that it's growing quicker than you think. So mentally I just felt I wanted it out, cleared up, and I knew we discussed HIFU, and I knew the advantage that it could be carried out fairly quickly. It was aimed at its target, and if necessary I can go back for it again. There's no guarantees with any of these treatments, and but it looked like the least likely to have side effects to it. And that was one of my driving forces. I didn't really want to live with all the side effects that are related to some of the other treatments. He was very good about allowing me to go away and read about it and think about it. I don't feel he particularly directed me towards HIFU, but it was obviously a speciality of his, and it just fitted in where I wanted to be. So I felt incredibly lucky that I'd actually ended up in his camp, if you like. I went in, it was all very easy. Sat down, was taken through the procedure again by Mr. Dudderidge, was taken into the operating theatre. It was all very calm, very easy. After laying down for a couple of minutes, anaesthetic went in, and no more until I woke up an hour or so later with no pains and no particular problems at all, of absolutely simplicity. After the operation, I was in hospital for a couple of hours. I had a catheter fitted, and to be honest, it was the catheter that was the biggest problem as far as I was concerned, which I then had to live with for the next week, and that was the longest week of my life. I have to say I hated that part totally. But after that was removed, it was fine. I'm a keen cyclist, so I was back on the bicycle within about 3 weeks and all forgotten about. One of the other benefits of HIFU is the fact that you are observed or actively observed following that. So every 3 months I have a PSA test. Every year I have a scan. It's been clear sailing all the way. I've had no further problems. I was asked to do this, and one of the reasons I wanted to do it was not for me, because I've actually forgotten all about it now, and quite honestly I'd like to get on with my life and not really think about cancer anymore, but really to help other people who are moving forward, and to say that it's not a major issue. You can get through it, and HIFU is a really quite a nice option to go with, if that's a good word.